Now, it sounds surprising, but over the last few years, one of the hot areas in mental health research is the link between mental health issues and the immune system. Depression seems to be associated with an overactive immune system, perhaps causing inflammation in the brain. Schizophrenia may be associated with infections in mothers, and it's been known for many years that chronic stress, where you feel out of control of your life, can profoundly affect the brain. People have also wondered whether mental health issues are associated with immune disorders such as ulcerative colitis and asthma. And a group at Yale University in the United States has shown that this is indeed the case. The question is whether there is shared genetic risk and in what direction does it work. Dr. Daniel Tiley was the lead author.
The main message of our findings is that there is a significant proportion of shared genetic risk between these types of disorders.
So just give us a sense of which psychiatric or mental health issue with what immune problem.
The ones that feature most prominently in our results were associations between major depressive disorder, so depression, and asthma. And we also saw associations between schizophrenia and two of the inflammatory bowel disorders, that's Crohn's disease and ulcerative colitis.
One of the issues here is directionality, horse and cart, chicken and egg. And if I understand the results correctly, the direction of flow of the risk seems to be mental health issue first, immune disorder second. It looks as though having a mental health issue drives some abnormality in the immune system. Have I picked that up correctly?
I think you do have the gist of our findings. The genetic liability for some of these psychiatric disorders, major depression and also schizophrenia, appears to increase the genetic liability for the immune-related disorder. That would be consistent with a causal effect of psychiatric disorders on immune-related disorders, or at least a partially causal effect.
Does having major depression, something about having schizophrenia or psychosis, which changes the immune system, it could be smoking, it could be something else, that actually drives a risk factor for immune disease?
It is entirely possible that these sort of mediating factors or confounding factors, so factors like smoking, drinking, health-related behaviors, how much sleep you're getting at night, how much physical exercise you get, what's your body mass index, these are all things that could potentially mediate a relationship between one set of disorders and the other. People's lifestyles are dynamic and changing. It's challenging for studies to measure them, and we try to statistically adjust for their effect. And for the main conclusions of our paper, the relationships do appear to be statistically independent from some of these other factors that we thought could be mediating the relationship. Because even though we say it's an environmental factor like smoking, smoking behavior has a genetic, a heritable component also.
But as a psychiatrist, there is growing evidence that depression can trigger the immune system and cause inflammation in the body. And there's certainly growing concern that schizophrenia has an immune component itself. And I suppose what I'm asking here is, does having mental health issues fire up the immune system and then produce in a genetically susceptible person the asthma or the ulcerative colitis?
Our study falls a bit short of being able to demonstrate this, but in general, there is a substantial body of literature indicating that things like chronic stress, emotional distress, psychological distress can cause changes in immune signaling molecules, immune cell responses. So one possibility is that chronic stress or chronic activation of these hormonal and neuroendocrine systems that respond to stress can lead to changes in the immune system that then dispose people towards immune disorders. That's one possibility.
And presumably because you're just looking cross-sectionally at people at a moment in time, you can't say whether treatment of the psychiatric issue or the mental health issue affects the autoimmune or immune disorder.
We don't have the capacity to know whether treatment of an underlying mental health issue would necessarily decrease the risk for developing an immune-related disorder or decrease the symptoms of an immune-related disorder that already exists. But it's a really interesting future direction for the field.
So for the general public, what's the message from the research from your point of view?
The most appropriate message for the general public is that when we look at genetic data, it seems to suggest that liability to some of these psychiatric disorders may be increasing risk for the development of certain immune-related disorders. I guess it underscores the need to re-examine preventative medicine and managing stress in ways that are healthier. I think it's important to keep in mind that these are conclusions that we're generating from population-level data. They're not directly relevant to understanding the comorbidity of a psychiatric and immune-related disorder within any particular person. There are lots of convincing examples where an immune disturbance seems to cause neuropsychiatric symptoms or syndromes, and it's really important that we understand those mechanisms. But in this case, what the data suggests is, on the whole, it looks like behavioral disturbance, in most cases, may be giving rise to immunologic disturbance.
Daniel Tiley is in the Department of Psychiatry in the School of Medicine at Yale University in the United States. This has been The Health Report, and I'll see you next week.
And so will I.
ABCRN helps you understand the world. Find more of our stories on the ABC Listen app.